So I am trying out a completely new setup this evening for the show between my audio, my camera on one side, my laptop on the other. So I'm really going to depend upon you guys for your feedback in terms of audio, making sure that you guys can hear me and everything is going well. So when you jump on board, guys, tonight, I really need you to speak up and let me know if you can hear me on this microphone. I have a new microphone set up. I've been working to try to get it to work. So as you jump on board, give me a shout out. I'm going to give you guys a couple of minutes to jump on board this evening. In the meantime, I'm going to have my super fizzy icy Diet Coke because, man, it's been one of those days. Oh, Ryan, wonderful. You can hear me. Yes, because I often have to use my big girl Cuban voice, and by the end of the night, I am done. So it's nice to have a microphone that is supposed to be a very good and sensitive microphone, and hopefully I won't have to shout at you guys. I see some of you guys popping on board. Hey, what's going on, Benny, listening to me from the YouTube channel. So guys, I am broadcasting also to the YouTube channel, the Cosi Talks YouTube channel, because I know many of you don't necessarily care for Facebook or have a hard time finding me there sometimes. What's going on, Mark S? Oh, no basketball tonight, so that's why you're going to grace us with your presence. It's always a joy to have you here, Mark. What's going on, comadre? You can hear me? Good, I finally got it right. Woohoo! My tech team is going to be so proud of me. So let's get this evening started off well. Cheers to all of you. We've got my Cosi Talks glass. Yes, this is a shameless plug. I happen to think these are really cute looking glasses. So guys, you can find them on my website if you want to be a cool kid and have a Cosi Talks glass. Harsh, I am good. How have you been? And guys, you're going to see me looking up and down because I've got my laptop down here where I can read the comments. I've got the phone camera over there, just trying out a new setup this evening. What's going on, Stephen? We've got Stephen from Jacksonville on board. Chuck can hear me good. All right, and we got Michael. Oh, Michael Broderick, thank you for coming in, Michael. I'm glad you found the show okay. What's going on, compadre, man? Thanks for joining in. All right, guys, we are in full summer mode here in the Cosi Talk studio in hot, sticky Tampa, Florida. My 4 children are on summer break, so if you've noticed, I've been a little on social media this past week. It's because I'm just all of my duckies home and also trying to keep them busy. So that's the other fun part of it. Ooh, came out of isolation, Harsh. Yeah, we're starting to see the uptick over here as well in Florida with the COVID cases. So hopefully everybody is staying safe. All right, guys, you've got a happy physical therapist because I have a whole page full of questions. So guys, let me go ahead and introduce myself for those of you who are new or first time watching the show. My name is Cosi Belloso. Welcome to Cosi Talks. I'm a physical therapist, amputee specialist here in Tampa, Florida. I've been a PT now for a little over 19 years, and working with the limb loss community is my passion. So we've had this talk show now going on almost 4 years that I've been doing this talk show to be a resource for the limb loss community, for amputees, caregivers, and clinicians. This is to help inform, educate, and empower. The reason, for those of you who are wondering why I'm so happy when you guys send questions, is that's what this show is all about. It's to answer any questions that you may have. And it could be questions that perhaps your clinicians have already explained these questions to you, but you just need perhaps a different viewpoint or a different explanation, or just to hear it one more time. You know, repetition is the mother of memory. So those of you who have sent me questions on email, messenger, thank you. And those of you who have tagged me on Facebook support groups, love it when you do that, because then that lets other people in the support group know about this resource and about this show. So thank you again. Zoom in closer. Mark, afraid that one's going to have to wait. Because I feel like if I touch anything, I'm going to lose my connection and all the audio that I finally have hooked up. Earl asks, ooh, he's just jumping right on the ball tonight. I love it. Let's see. Earl says, should I learn to walk with a cane? That is a fantastic question, Earl. And this is definitely something to talk to your physical therapist about. A lot of times folks will, take the advice of their well-meaning surgeon and sometimes prosthetist. But honestly, when it comes to the walking part of your recovery process, when it comes to learning how to walk with your prosthesis, and this includes using a cane, a walker, crutches, whatever it is, this is physical therapy territory. This is where we really love to shine. Now, Earl, when someone comes in to see me in a clinic or when I'm treating a patient, usually I like to take a really good history on the patient. I like to know what they were like before their amputation. Were they walking? Were they walking independently? Were they struggling? If they were struggling, how long? Were they sedentary for over a year before their amputation? What did they look like prior to amputation. And for me, it kind of gives me a good picture as to where we can expect this person to progress with concentrated physical therapy, okay? And I always tell my patients, I don't have a magic ball where I can see the future, but I can kind of predict in what direction we are headed. Now, there are some patients that they are very well capable of learning how to walk without a cane and without a walker, okay? And I will set their treatment goals to reflect that, and that's the goal that we'll be working to. And there are some people that, in my experience, I might think to myself, you know, this person is going to do their best and have their best independence with mobility if they use a walker, a cane, or crutches, okay? And usually the way I phrase it to my patients is, we're going to get you to the point where you are walking independently with a cane or a walker. And then once we reach that point in your therapy, we're going to reevaluate you and see if that is where you will be, that is how your mobility will look like, or if it'll be possible for you to progress even further, okay? Now, Earl, as far as like the progress, you know, someone who's not going to be using a device, you know, someone who I think will be able to walk without a cane or a walker, it doesn't mean to say that they won't use a cane or a walker during that rehab process. And again, everybody is completely different. Okay, everybody's completely different, even in how they progress. I have some folks that they go from using a walker to using nothing at all. And some folks that they need to go from a walker to a cane to then using nothing at all. Okay, and a lot of it just depends on, you know, how are they looking? You know, how is their strength progressing? How is their balance progressing? How is their endurance doing, right? And then I'll say this as another caveat. I've learned never to say never. You know, I have some people that I expected would have been doing cartwheels, right, with their prosthesis, and they ended up struggling, you know, and they ended up struggling. And there are other folks that I thought to myself, this person, I don't think they're ever going to walk again. And they surprised me and beat the odds. And I love those patients. I really do. In that case, I love being wrong in those cases. So Earl, again, this is one of those many, many, many reasons that a physical therapist is just so important in the recovery process from day one, from the first day you come out of surgery until you've completely reached your goals with your mobility, and then onward in lifelong maintaining your fitness and maintaining your mobility. Yeah? Okay, hang on. Some things just came on board. All right, we got Spencer on board. Hey there, Spencer. Stephen asks, should an above the knee be able to don the prosthesis socket and wear it all day, or is 4 hours a normal amount of time? My residual limb seems to compress as I wear it and it becomes really tight. What should I expect as far as wear time and comfort? Stephen, that all depends on your day. I have some people that they wake up in the morning early, they're 6 a.m. up and ready for their day. They put their leg on and they don't take their leg off until 10, 11 p.m. bedtime. They might take it off during the day to adjust socks and adjust the fit of their prosthesis. That's a normal thing. Or they might take it off to perhaps just take a little bit of a break. But yes, it is it's expected. That is the whole goal of the prosthesis, is for you to use it as much as possible throughout your day. And again, everyone's a little bit different. But what I'm seeing here, Stephen, in your comment, it says that your residual limb starts to become uncomfortable. Okay. And for me, that should not be a reason why you're not wearing your prosthesis all day. Okay. Whether you wear your prosthesis for 2 hours a day or 12 hours a day, that should be a matter of choice. Okay. And it sounds like here there's something going on with that socket. So if you are swelling, usually it's the opposite. Usually the more people wear their prosthesis, their limb will shrink during the day and they have to add socks or tighten it up if they have an adjustable socket, okay? But in your case, if you're telling me that it's starting to swell a little bit, that indicates that there's just something going on there. Either something with the fit is not doing well and it's causing that edema to go down there. Stephen, I don't know if you have a pin lock and perhaps that pin lock is pistoning and it's causing the limb to swell. So these are just a couple things to think about, Stephen, but this is something you definitely want to bring up to your prosthetist and figure out what is it that's causing that compression. Another thing, Stephen, is take a look at your medical history. Is there something in your medical history that predisposes you to swelling in which case you might want to have a conversation with your doctor to see why this is happening. Okay, so I know I just threw a lot of things at you, but Stephen, if you're somebody who wants to wear your socket and you are an active individual, you should be able to wear your socket all day long. Okay, so have a talk with your prosthetist and see what's going on. Yeah? Hey, Liz. Oh, so glad you came, Liz. Let's see. Ryan says, great question for Earl about the cane. Glad to hear everyone is different. I try to compare myself to others in rehab that are older than me, and I had to tell myself we all do it our own time with great physical therapy. Yes, and Ryan, one of my favorite new sayings has become, comparison is the thief of joy. And this is something I've had to tell my kids when they're in school. It's something I've had to tell myself as I progress with my work and what I do, and just remembering everyone is at their own pace, at their own time, whether it's in their fitness or in their job or whatever it is they're doing. And yes, it really is unique to each person, Ryan. And again, even within a person's recovery process with physical therapy, some of my patients, they'll start off with a walker, we progress to a cane, and we hit a roadblock and they have to go back to using the walker, and then we might get a little time where they're not using anything, and then they might go back. So, you know, it's an up and down progress, and with a slow uphill, you know, with progress there, okay? And yes, everyone is different. Everyone is different. Hey, Patrick, there's my other physical therapist man right there. Oh, we got Denise on board. Oh, Denise, I'm so glad. There's my Tar Heel girl right there. We got Pastor David and Rhonda. Jill says, the more I wear my socket as an above the knee, the more I shrink during the day as opposed to swelling. Yes, and for the majority of folks who wear a prosthetic device, the residual limb shrinks. And the reason is because you are pumping fluid out of that residual limb as you use the leg. Your muscles contract, it gets the circulation going, and any fluid that came down into the leg overnight or when you had the prosthesis off gets pumped out. So again, when I hear about someone whose limb is swelling after using the socket, that to me is just a little bit of a red flag to say, what's going on? Is this a normal part of this person's process? Is this how they normally present because they might have vascular disease, right? And if they spend their time with their leg down too much, but oftentimes I feel like there's something going on with the fit of the socket itself. Like if perhaps it's compressing too much in one area and causing that limb to swell. Or if the limb is pistoning in that socket, meaning it's moving up and down in that socket with a pin lock, and that's going to cause things to swell as well. And if it's not a good snug fit, lots of things can happen. But basically, if the limb is swelling after you've been wearing the limb, that's usually a time to have a conversation with your prosthetist. Okay. Let's see. Hey, Ben Gregory, glad you could join in. All right, guys. And guys, like I said at the beginning of the show, and I'll say it again, I am using a new microphone and camera set up. So if y'all can just give me feedback on if you can hear the audio crystal clear, or if you're having to kind of strain to hear my voice, feedback, please. Steven says, it's been 4 years and I'm on my third prosthetist and it's been up and down. I had a socket and returned to work for a month for 8 hours, but I had to stop my career due to not being able to perform the work of 30 plus years. It's like my limb compresses now and sinks down into the socket. Okay, so Stephen, when the limb, if you're saying that your limb is sinking down into the socket, then that actually means your limb is shrinking and you're bottoming out. That's what that means. If you feel like the bottom of your limb is hitting the bottom of your socket, I mean, we call it bottoming out. And that's a very easy thing for the prosthetist to check. Usually what they do, and this is a hack that I picked up way at the beginning of my career, to see if you're bottoming out, Stephen, take a little bit of lipstick, your wife's lipstick, your spouse's lipstick, and put a little dab of it on the bottom of your socket. Okay? When you put your residual limb in, the lipstick should not stain the bottom of your residual limb. Does that make sense, guys, what I'm explaining? Some of you have probably had your prosthetist do this before. I know one of my favorite prosthetists, he has this tube of bright red lipstick in his clinic, in the clinic room. But you get the lipstick and you put a little dab of it on the bottom, the very bottom of that socket, right down at the bottom. Then put your residual limb in, walk around, and take your residual limb out. If you have lipstick stains on the bottom of your residual limb, that means you are bottoming out and you are hitting the bottom of that socket, and you may not even realize it, okay? So Stephen, that could be why it feels compressed, because yeah, if you're hitting the bottom of that socket, that means it's kind of pounding down there at the bottom of the socket. So it could be the opposite. It could be that you're actually shrinking and not realizing it. Does that make sense, Stephen? Again, go talk to your prosthetist. Because yeah, if you're, for somebody who is a hard worker like yourself and you sound like you really want to get back to work, the socket shouldn't be what prevents you from going back to work. You know what I mean? I never like to hear that. Hey, Timothy, glad you could join us. So Ryan, that's a good question. Ryan is asking, can I share how and if I'm available for virtual visits? Do insurance companies approve virtual PT sessions? So long tangled story is this. When COVID hit and the shutdowns happened, the Trump administration actually relaxed a lot of the rules regarding telehealth, right? For obvious reasons. And they allowed doctors to perform telehealth visits across state lines. Does that make sense? So a doctor who was licensed in Texas could potentially telehealth a patient in Tennessee, right? Unfortunately, that courtesy did not extend to us as physical therapists, which I was kind of bummed about. So as far as an actual physical therapy visit, it is not allowed for telehealth across state lines. So for example, I'm in Florida, I could theoretically telehealth a physical therapy visit to another person in Florida, okay? But I could not do it to someone else. Now, do I provide consultation? Yes, but we don't call it, it's not physical therapy, it's a consultation visit, and it is not covered by insurance. And as far as traditional telehealth physical therapy, I do believe that some insurances are starting to cover it. But again, my own practice is an out-of-network practice, so I don't deal with insurance. So I don't know all the up-to-date on that. Yeah. So, you know, it's one of those like, okay, trying to see how technology can help us out, right? Okay. Thank you guys. Oh my gosh, good. I'm so happy. Y'all don't understand. I don't know, y'all who watch the Lululemon show I did at the store, and I was Zach Gowan, and I thought I had all the audio working, and I had tested it out. I was so excited, and I pressed live, and it stopped working. And it took me a really long time to figure out which switch I had forgotten to turn on. So glad I got this straightened out. All right. Awesome. Yay. So glad you guys can hear and see me. Wonderful. Thank you guys. Let's see. Liz asked, do I answer the questions asked on my website? Yes. So Liz, okay. So on my website, guys, I'm going to go ahead and put it down here for you. Okay. So on my website, you can actually email me directly. And yes, I answer all of those questions. I wish I had an assistant, but I don't. And one of the things I love most about doing this show is answering your questions. So guys, don't be shy. Send me your questions. And yes, so sometimes I'll get the questions that people email me. Sometimes I'll get the questions from people who tag me on Facebook, which is also wonderful because it allows me to share what it is that I do with this program. All right, let's see. Rhonda says, mine uses a Play-Doh ball and it's flattened if you're far in the socket. Right, that's another little trick to use is if you get just a little, just a little dab of Play-Doh, roll it into a ball and put it at the bottom of your socket. Then you can see if you're flattening it out. I prefer the lipstick just because it doesn't roll around in the socket. So it's just easy to just mark and it's just kind of funny pulling out a tube of red lipstick in the middle of the clinic. I just get a kick out of that. Go figure. All right, so let's answer some of the questions that came on board. Here's a good one. This one's from Liz. Liz asks, any suggestions on how I can get up from the floor into my chair with the prosthesis on? I am a bilateral above the knee amputee. And this was a skill that I learned very, very early on in my career. It was actually my very first bilateral above the knee patient. And to date, he's probably been my most challenging case. Y'all have heard me refer to this particular case on a couple of occasions. He was lovely, lovely individual. He lost both of his legs. He was pinned between two UPS trucks when he was on duty. So it was a pretty traumatic incident for him. And he was a very large man. And this was a man that we had to actually put him on a weight loss program in order to get him successful, to be able to fit into his stubbies. And it was an incredible case. So obviously one of the challenges with this man was, being able to figure out how to continue challenging him to strengthen him, right? He was a young man, and because of the fact that his residual limbs were so short, we had to get really creative on how we could continue to strengthen him. So one of the ideas that I had was, well, I'm going to teach him how to get from the floor up into his wheelchair. You know, being a big guy, just using his body weight alone was going to be a challenge. So Liz, when I work with bilateral above the knee amputees, one of the strategies I use is to do little progressive steps. Okay, so I teach the person like a dip. So you know how when you're, ooh, you guys can actually see me doing this from this angle too. Okay, so you know, just the process of doing this exercise. Okay, and you can see I'm getting quite a bit of distance in my height, and I'm not pushing with my legs. This is all with my arms. Okay, and Liz, this is actually one of the exercises in my program and in my book. It's in the arms section. Okay, pushing down in that chair. So in doing that, you're just kind of preparing your shoulders, getting your triceps, getting the back muscles ready to be able to push, okay? So once you're able to do this and kind of just sustain yourself, then what I used to do is I would put a little step behind the patient, maybe just a step about yay big, and just have them lift and push themselves back onto that small step, and then come back down again, okay? So it was just basically using graded steps, okay? So once they were comfortable doing that small step, going up and back and then and forward, I would put a larger step and a step and a larger step and so on until they had the strength, okay, to push themselves up into that wheelchair, okay? Now, obviously that requires a lot of upper body strength, a lot of, you know, back strength and shoulder girdle strength, okay? So this is something that would take time to build up that strength, and hopefully as well that you don't have any problems with your shoulders. If you have issues with your shoulders, then you got to get creative and try other techniques. But that's a really great basic technique that it builds the upper body strength, and it can be done in a way that is safe. Like you don't have to be on the floor practicing and then figure out how you're going to get back up off the floor, right? This is something that you can start practicing from your chair with this strengthening exercise. And it seems very simple, but guys, it's really, really effective. Okay, so that's one of the ways. Another one is when you go to Mission Gate, and I have been meaning to make a video on this. This is on my to-do list, guys, but for the meantime, I love using Mission Gate. Mission Gate has a phenomenal YouTube channel. I have some of my own videos that I've done with them on there, and they have a couple of really great videos on how to do floor to chair transfers. And again, this one, there's like so many different ways that you can do this particular strategy, and it all depends upon, you know, what is it that you have to work with. You know, I had one lady, she was 73, she is 73 years old, and you know, fantastic shape, but her shoulder was in terrible shape. She was getting ready for a shoulder replacement, and she's an above the knee amputee on the other side. So obviously with her, we had to really kind of we had to really try a couple of different ways to figure out how we could help her get up off the floor without tearing apart that shoulder that was already ready for surgery. So again, this is something that it's a skill that should be practiced in physical therapy. This is something that some PTs might be hesitant to practice with their patients, but I'm a huge advocate for it. If this is something that you are a candidate to do, not everyone's a candidate for it, but if you're a candidate, then you should be practicing this with your physical therapist. All right. Oh, thank you, Van Gregory. It's the gun show here. All right, here we go. Yes, wheelchair push-ups. Exactly, Mark. All right. So Liz says, yep, that's what you do. Good. So again, Liz, I would suggest finding a small step, something that you basically can scoot your butt up onto and start practicing that motion right there. All right, let's read what's going on. Oh, that's lovely. Thank you, Marianne. Okay, so Liz, meet Marianne. She just posted that comment down there. Marianne is one tough cookie. So she said if you message her, she can give you a video of how she gets up off the floor, and she is a bilateral AK herself. So glad I made that introduction. Wonderful. Okay. Ooh, Here's a good question from Paula. Paula says, although the videos don't say to, I'm assuming all exercises should be done in the residual limb and the sound limb, like the tennis ball roll, things like that. So what Paula's referring to, and here's my second shameless plug for this evening, is my Strong Body program. Okay, so many of you have already subscribed to my program. I put the link there. That program has 150 exercises for above the knee and below the knee amputees, for arm, leg, core strengthening, balance, and flexibility, for beginners through advanced fitness levels. So we've got everything covered in that program. And then with it, we've got the Strong Body books to go with it. So it's all in here as well with all the explanations. So what Paula was saying is, you know, should these exercises that I put in here be done with the sound limb? And the answer is absolutely yes, absolutely. You know, in my clinic or when I see patients, I usually see patients now long after their amputation. When I worked in the hospital setting, it was easy for me to grab patients before they left. So I could see patients right after their amputation and follow them through the whole process. But since I'm an outpatient clinic now, sometimes the trickle effect, my patients don't get to me for, you know, months and sometimes even years after their amputation, right? And what I find with these patients is sometimes the sound limb is weaker than the residual limb. Okay, and this can happen for a few different reasons. It could be that the person was focusing more on their residual limb, not realizing that their sound limb also needed work as well. So yes, whenever you are using these exercises, certainly use it for the sound limb as well. Absolutely, absolutely. And what's interesting is I've had actually a couple of runners who are not amputees purchase the program and they're using it themselves as non-amputees. So, you know, if you have a full-size limb, this is definitely exercises that can be done for it as well. Robin, oh, Robin, I know we haven't chatted in a long time, girl. I can't wait to catch up with you. Oh, so happy to see you. I'm frozen. Uh-oh, am I thawed out yet, Megan? Am I back? I'll take a sip of my Coke while I'm waiting for you all to answer. Better? Okay. Yeah, you know me and technology. It's always a good time. Whew. All right. Okay. Man sent in a question. Okay, and this was a very good question. So Marianne, I'm going to brag about you just a little bit because you are such a hard worker, and she is so determined to improve her mobility. Hey, there's my occupational therapist. Oh, what's going on, Andrea? Thanks for making it, girl. All right, you know, Marianne is someone that just really impresses me all the time because she is working so hard to improve her mobility, right? So one of the questions she asked was, you know, I feel like the therapy I'm doing right now, it's not improving my strength, and my therapist seems to want to focus more on the walking part, but I feel like I should be doing more on strength. You know, what's the deal? But I feel like we're not progressing. Okay, so let's talk a little bit about strengthening and how you know when you have to start challenging yourself, if you're challenging yourself enough or not. Okay, so first I want to remind you, when it comes to the strengthening and muscle strengthening and anatomy and physiology, I have a wonderful, wonderful video, if I do say so myself, on the Cosi Talks YouTube channel where I really go in depth and explain how muscles are strengthened on the fiber level, right? To strengthen a muscle, you have to recruit more muscle fibers and you have to overload those muscle fibers to cause them to tear just a little bit, right? And when they heal back stronger. Okay, so the more you challenge that muscle, the more your brain is going to recruit more fibers, and those fibers are going to get beefier and stronger, right? So how do you do that? How much is too much? How much is not enough? Okay, so when I work with my patients, guys, it's really, and this is also for my own fitness as well, it's really about the individual muscle group. Okay, if you start off and you do 10 repetitions of the exercise, and you haven't felt anything, okay, then either A, you need to examine the form. Are you doing proper form or are you cheating, right? B, are you doing enough repetitions? Sometimes we need to do 15, sometimes upwards of 30 repetitions for a particular exercise, like the tennis ball exercise. That's one where I really jack up the reps. And are you overloading the muscle enough? Is it time to add a TheraBand? Is it time to add weight? Or is it time to modify the exercise and move on to the next level exercise to make it more challenging? Okay, so these are questions that I'm constantly asking myself when I'm working with an individual. Am I challenging them enough? The last 2 to 3 repetitions should feel tough. It should feel tough to finish, right? And after you finish a set, whether you do 7 repetitions, 10 repetitions, 15, 20, 30, you should need 30 seconds to rest. Like, you should have worked hard enough that you need to say, okay, I need a 30-second rest, okay? If you're not doing enough, okay, then you're not going to challenge that muscle, okay? And then there's obviously the other side of that spectrum, doing too much. You know, if my patient comes to me and says, oh my gosh, Cosi, you worked me so hard, I can't walk for 3 days after therapy, then I know I really overdid it and we need to back off on the intensity level, okay? More muscle soreness does not indicate a better workout. It just means you trash the muscle a lot, okay? So it's a very delicate balance, okay? The other thing, and this is something, guys, that I am learning myself, because even though I'm a physical therapist, I do not like strengthening. I don't. I will run till the cows come home. I will run for miles and miles and miles on end for my fitness. But when it comes to doing a strengthening program, I am terrible. I am terrible. I'm getting much better though. And the reason why I am terrible at it for myself is because it takes a long time to see results. Right? And I don't have the patience with myself. I have patience of Job with my own patience, but when it comes to myself, I'm like, dude, I've been doing this program for 2 weeks and I'm not seeing any changes here. I'm done with this program, okay? When it comes to a strengthening program, guys, it takes weeks and months to see the progress. Months, okay? And I was telling this to Marianne in the email that we were exchanging. I said, you know what? My own fitness program now, I have been doing the same exercises for 2 months. 3 times a week for 2 months. So I've been really consistent in doing it. And it's only now, 2 months later, that I'm starting to finally see changes in my muscle strength. Okay. And now I'm looking at the program going, okay, now I need to modify my program and make it a little bit more challenging. Okay. And to be honest, this is probably the longest I've stuck with a strengthening program. I know. Do as I say, not as I do. Okay. So guys, these are things that you really need to examine, and then just take a look back. If you're frustrated because you're not seeing any gains in strength, you got to kind of take an honest look at yourself and just look back at your calendar and say, okay, have I really been strengthening this muscle group for 2 to 3 times a week consistently for several weeks in a row? Chances are you probably haven't. I know I'm guilty. I'm guilty. Okay. And then when it comes to, so with all due respect to the particular therapist, who told this individual that they didn't need to continue doing strengthening, they were already pretty strong, I respectfully disagree. Okay, strength is something that we have to maintain lifelong. Whether you are an amputee, whether you have 2 anatomical legs, whether you have any injuries or not, okay? Strength is something that you have to continue maintaining, and it's something to always, that can always be improved upon. And yes, you have to do a lot, okay? A lot of work on the gait, and there's a lot of gait mechanics that are involved. But a lot of times, the problems going on with the gait are only going to be resolved if you're doing the strengthening with it. Okay, and guys, even as a therapist, I fall into that trap sometimes where I'll just be like, why is this patient not improving this part of their gait? Why? And I go, you know what? We've been dropping off on these particular exercises lately. We need to bring them back into the equation and get their strength going to see that improvement in the gait. Okay, so guys, when it comes to strengthening, always have that conversation with your therapist. Am I doing enough? Am I doing too much? How can we modify to make it more challenging if these exercises are too easy for me? Or if you feel like I'm already strong enough. Okay, no therapist should ever tell you you're strong enough. A therapist can tell you you're very strong. Now, how can we get you even stronger? Right? Okay. All right, let's see. Okay, so Ashley says, can you touch on the test for neuroma? Okay, whoops. Am I frozen again? Doo-doo-doo. Am I back? Sorry, guys. It looked like on my screen I was frozen. Okay. So, guys, when it comes to neuroma, usually when my patients come into my clinic and they're complaining of pain in the limb or a phantom pain, and I tell them, point to where you feel the pain. A lot of times, my folks with neuromas and bone spurs can take their finger and point directly to the pain, and they'll say, it hurts right here. So my really nice way of testing for that is to get my thumbs and to kind of push into that area. And I know that sounds horribly cruel, and I really don't enjoy doing that to my patients. But since I don't have access to MRIs or ultrasounds or CTs or x-rays or any of that kind of fun stuff, all I have are my two thumbs, right? So I'll push my thumb into that area, okay? In really extreme cases, if it's a superficial neuroma, the person will feel it right away, and they just, whew, they see stars. Sometimes, and this is very rare, but sometimes I can actually feel a bone spur. If it's a large bone spur and it's a very slim person with a lot of muscle atrophy, you can sometimes feel that bone spur, and I've seen some pretty big ones, right? But basically, with an neuroma, I believe they usually can use an ultrasound, and that's how they can kind of see if there's something going on in there, or an MRI, or I don't think a CT would necessarily be used. This is where I'm not a radiologist. But this is, again, something that a surgeon can evaluate to look for. So, for example, if you are in the process of having a revision done, okay, and you have pain in your limb, you know, my thought process is if you have pain in your limb and they're already going to open you up to do a revision, then they should be screening you to see if you have any neuromas. And that way, if you do, they can do the targeted muscle reinnervation procedure. Okay, and this is something that we've had on the show. We've had TMR Nerve on the show, and they have been a wonderful, wonderful resource and support for me this year. And I'm putting their website down. Okay. So for those of you who are wondering, do I have an neuroma? Is it forming? Am I having pain in my limb? You know, they have a directory of physicians by state that have been trained in this procedure. And for me, those are the physicians that are the best at diagnosing whether or not you have a neuroma and where that pain is coming from. Make sense? All right. Let's move on to this next question. This is always one of my favorite questions when I see this question floating about the support groups. Tracy asks, are there physical therapy clinics just for amputees and prosthetics? If so, how do I find one? Okay, so I believe some of my viewers have called us unicorns, those of us who are physical therapists that specialize in amputee work. There's unfortunately not too many of us, but I am going to give a shout out. There's one lovely lady. Her name is Michelle Jamin. She is a physical therapist, up and coming physical therapist, and she just recently opened a physical therapy clinic just for amputees up north. So the name of that clinic is called Align Rehabilitation. So we're going to give that girl a shout out right there. And this is her name, guys. Okay, so those of you up north, she's on Instagram under Align Rehabilitation, so you can see where it is that she practices from. Down south here in Florida, we got me, little old me. So as far as amputee-specific clinics, you're not going to find a whole lot of them. You will find the occasional physical therapist who specializes and works with amputees, and they're tucked away in a hospital or in another outpatient clinic. So the easiest way to find this, and it's not easy sometimes, look into your support groups, guys. That's usually word of mouth is how a lot of us physical therapists, share about our practice, right? There we go. We got another one. Steve Pompilio at Brooks in Jacksonville. Okay. So they are out there. You just have to kind of search and look. Unfortunately, there's no directory just yet. I know the Amputee Coalition has a directory of prosthetists in the United States. I'm really, really hoping that very soon that they will someday do a directory of physical therapists in the United States. Hint, hint, wink, wink, nudge, nudge. Yes, can we make it happen? Okay, but yes, there are physical therapists out there who specialize in working with amputees, and this is something that you hear me talk a lot about and advocate for in finding that physical therapist worth the effort. All right, next question here we've got. Okay, so this was a bit of an extended question by Michael. Michael says he's a right above the knee amputee since May of last year, so he's a little bit over a year out of his amputation. Several weeks in ICU, months of being at a facility with a lot of muscle atrophy, just now starting to stand to a walker and walking slowly. I've been walking with one hand at the parallel bars, but I lack core and glute strength to support myself, right? And the physical therapists that I'm seeing 3 times a week do not have experience related to my injuries, because it sounds like you have multiple injuries right above the knee, fused elbow, tons of other work in the body. So I've started looking elsewhere to apply in PT. Okay, so I'm going to stop there. There's more questions here, but in that first part, guys, when you have someone, yes, Andrea, the APTA, I know, like there's a small group of us that, you know, between Torin and Sheila and Chris Durger, that they're trying to get that APTA. APTA, guys, is the American Physical Therapy Association. It's kind of like our governing body in the United States, and we're trying to create a special section just for amputee specialists. So I don't know where that's at right now, but I know we're working on it. So going back to Michael, when you have someone who has multiple injuries like this in a very complicated case, you know, you not only have the right above the amputation, you're also dealing with elbows that are, sounds like they've been contracted there, and severe muscle atrophy. You might actually want to go and check out the trauma center near your area. Okay. The reason I say this is because when you go to a trauma center, that's actually where I did my training, at a level 1 trauma center in Miami, Jackson Memorial Hospital, right? Working with trauma patients, that's our bread and butter. You know, the majority of the patients that I would see coming into the trauma unit at Jackson Memorial had injuries head to toe. I mean, these were people that were just in horrific accidents, right? Not only did they have an amputation, they had a spinal fracture, they had a traumatic brain injury, they had, you know, several bone fractures, they had a chest tube going in here. I mean, so they, you know, as therapists, we train to work with people with many, many of those injuries, and they have outpatient centers. Okay. So this is another possible resource for you to look into, is going to a place like this, because a lot of times these therapists, they get rotated to the different units, right? That's what happened to me. Every 6 months, I got rotated to a new unit. Okay, so when my patients would come in and they'd have multiple different types of injuries, I knew how to address all the different injuries. Okay, so for someone like Michael, this would be a good place to start, right? Finding a therapist who's comfortable dealing with all these different types of injuries. Okay, moving on with his question, it says, with all that said, what is normal? Is having no nerves or feeling the limb below the hip normal? Is the limb being limp and unable to control it normal? When I'm laying in bed, I can't lift it off the bed on my own, but I'm able to lift it just like a loaf of bread with my hands. Okay, and transferring, it goes where gravity goes. Is this just a result of not having any strength, or is this just normal? And again, Michael, this is something that this could be the result of, you know, severe muscle atrophy, that you just simply do not have the strength to be able to lift your limb up off the bed. Yes, that could be as a result of the atrophy. Could there be nerve damage? Yeah, possibly. But again, this is something that a physical therapist screens for, right? And B, your doctor should be screening for this as well, right? So I would say, Michael, you know, if you're in the process of looking for a new therapist, go check out the trauma center. The local trauma center, every big, large city will have a level 1 trauma center somewhere nearby, and just start looking at the physical therapy outpatient clinic that they have, right? And again, you know, if you even have a trace muscle contraction, right, then you can start to work on that and start building upon that, right? Okay. So Patricia says, I am a left above the knee amputee using a walker and crutches, and the area between my thumb and pointer finger gets so painful. Oh, Andrea, I'm going to call you in for this one. Any suggestions? Ice helps at night, but then as the day goes on, it gets bad again. So yeah, that is the thing, guys. When you're using a walker or crutches, especially with the crutches, I find there's more, your upper body gets beat up, right? The hands get beat up. One thing you might want to think about, Patricia, I know, Marianne, I know you're not near a big, large city. I know, darling. I know you're not near a big, large city, but, you know, for other folks watching that are near a big, large city, you can try to find that trauma center with a physical therapy clinic attached to it. Okay, I know. So, you know, when it comes to the using the walker and the crutches, usually when a person's telling me, oh, that they're experiencing pain, I like to see how it fits. Sometimes the person will set the walker up too high, too low. Same thing with the crutch handles. And that can put unnecessary stress on the upper body, on the hands, you know, it can cause soreness and pain there. And we don't want to cause a chronic overuse injury there from that end either, okay? So having someone check out your alignment, Patricia, and just see is the walker aligned properly, or the crutches aligned properly. And the other part of it is, you know, how you're using it, the kind of grip that you're using. So it sounds like you're really, really leaning into it this way. And sometimes folks will hold on to it this way. And just by adjusting the grip, where more of the body weight is placed into the arm, right? So if we put all the weight into this part, you know, of our hand, then that's going to be incredibly sore. But if we change even the grip on how we're gripping it, that's going to help distribute some of, that's what it was, distribute some of the weight into your arm muscles, and that can help a little bit in the long run. But Patricia, start off first with just seeing, like, you know, what does the alignment look like? Okay, do you need to adjust the height on anything? I keep looking down here because my laptop is right here, but y'all are up there. It's going to take some minute to get used to this. All right, guys. So I think I've answered all the questions that came in for this evening. So I'm going to hang around for another minute or so and see if you guys have any other questions that you want to ask me. If you guys don't mind if I take a quick poll, how many of you have the Cosi Talks subscription to the videos? And how many of you have purchased a book? I would love to just know, get a feel as to who got what. Let's see, Andrea says some advanced crutches have more ergonomic handles, stretch out daily, fingers and wrists pulled back. Ice, yes, and Voltaren gel helps some folks. See, that's why I love having an occupational therapist on board. This is my peanut butter to my jelly. Here we go, right there. Ryan has the book. Marianne has both the book and the subscription. Liz has both. Ashley has the book. Let's see, Mark has the first time. You have neither. Mark, check it out. Let's see. Megan has both. Thank you guys for letting me know. Paula has the program. Mark has both. Patricia has both. Okay. Video. Phil has the video. Okay. Awesome. Thank you guys. Thank you, thank you, thank you. All right, let's see what Michael says. As a follow-up, walking one-handed at the parallel bars is improving. Today in therapy, I was still just flinging my good foot forward, was very unstable. It is a matter of core strength and glute strength on my amputee side. Yes, a lot of it, when it comes to doing the one-handed walking, Michael, the person has to be really, really strong with their glutes, especially so if you are, sorry, I gotta remind myself, you are a right above the knee amputee, okay? So you should theoretically be using your left hand to give you the most support, okay? But yes, you need to work a lot on glute strength, certainly on core strength. That goes hand in hand with that. But the glute strength is what's gonna really give you that stability when you take that step, so that your hip doesn't dip down, okay? And you're nice and secure and stable. Okay, David's got the book and subscription. Andrea's got both books, and she's a non-amputee. And I love it. I love it when the clinicians buy the books. That just makes my heart smile. Butch says he's got the book, and Van Gregory says neither yet. Okay, guys, I'm going to type it up there. This is a program that, yes, I developed it, but guys, I can't tell you how much I've been using this program with some of you as my viewers who send me questions, with my patients. And I've had some wonderful feedback from clinicians who have been using my book as well, and the program with their own patients. And just seeing these exercises, especially the videos, guys, when you can see the video, I know I'm a very visual learner. So for me, I have to see someone performing the exercise to really be able to get it into my noggin. And then just all the education, lots of education in these books and in these videos. So guys, if you have the chance, check it out. There's the website right there. There's sample videos on that main page. So you can get a look and feel as to what these videos are like. And everything that's in the videos is also in the book. So they're kind of meant to work together hand in hand, right? So every single one of the exercise videos has a book entry, full color pictures, lots of description. lots of education, and also lots of nice personal stories in there as well. Thought I'd make it fun. All right, so Michael says you use the right hand. Well, that's okay, yeah. So if you're a right-sided amputee, Michael, and you're starting to learn to walk with one hand, we traditionally start you with the opposite hand. Think of it as a bridge, right? You got to provide that other support to the other side of the bridge. What just happened there to my phone? Oh, that's funny. And I'm not sitting very ladylike today, am I? Okay, I think my gimbal just lost battery. There we go. Okay. Oh, thank you, Ryan. I do appreciate that. I appreciate that, guys. Thank you so much. Hey, Steven. All right. Well, it looks like my audio setup or my visual setup, camera setup just went wonky there. So that's all we have for tonight, folks. All right, guys. If you have any questions, please send me your questions. You can email me directly at cosi@cositalks.com. Oh, Paula, I appreciate that so much. And yes, guys, I mean, I use this program myself for my own fitness, for my running and things like that. And some of these exercises I'm doing phase one exercises, and some of the exercises I'm doing at phase 2 and 3. So it's kind of nice that you can kind of customize it to your own needs there, right there. All right, guys, so with that, I'm going to sign off for this evening. I'm going to see what's going on with my camera there. I will see you guys next week, same bat time, same bat channel. Send me your questions, and I will try to find you those answers. But as always, guys, thank you for letting me be a part of your lives this evening, and I will see you next week. God bless. Bye.